Pediatric brain tumors are challenging to treat, but I can assure you we have the best team to treat them. When a child presents with a pediatric brain tumor, the classic symptoms may include headaches, vomiting, changes in the level of consciousness, abnormal eye movements, functional or academic decline at school, or even seizures.
Patient education is a high priority for our providers. We developed the area's first spine surgery educational program to help ease patient anxiety and improve outcomes. Neuroscience group surgeons participate in the Quality Outcomes Database, which gives you objective evidence of our high-quality care.
Everybody, as they age, they shrink. The brain is no exception. Shrinkage rates or atrophy rates in multiple sclerosis patients are substantially or can be substantially higher. At Neuroscience Group, we have the ability to measure that volume from the get.
The Savvy Scout is a small radar reflector, smaller than a piece of rice, that can be placed in the breast that allows your surgeon to find the area of concern. It can be placed any time prior to the time of your surgery, which allows us more flexibility in the scheduling of your surgery, in addition to where we can make the incisions on your breast.
And a normal esophagus can generate anywhere from 35 to 135 units of pressure to push things through. The magnets open up, the food falls through, and then the magnets draw back shut to seal things behind it. If people need to vent their stomach or belch, or if they have to vomit, they're adding pressure to their stomach with these muscles to open up the opposite direction. So it does allow for a significantly less side effect profile compared to traditional laparoscopic procedures.
So robotic surgery, it's been kind of a process that has been developed over many, many years. It allows the surgeon to precisely position a screw in the spine or any other type of devices we may need to position, and usually has an accuracy of about 1 millimeter off to where you desire to put that object.
Hi, I'm Dr. Lorenzo Cervantes, and I want to thank you for choosing me to perform your surgery at Griffin Hospital.
Uterine fibroid embolization is an outpatient procedure with medication to get you relaxed and comfortable. We take a small catheter about the size of a pencil tip, introduce it into an artery in your upper thigh, then under X-ray guidance, pass that small catheter into the arteries supplying the fibroids. We block up those arteries with small particles. The procedure takes about an hour to perform. Once the procedure is completed, we take out the catheter and put compression on the small incision area for about 15 minutes.
The cloths reduce the potential for bacteria, so we want you to use them the night before your surgery and again in the morning. Bathe or shower the night before your procedure, and use a clean towel to dry your body. Then, use the provided chlorhexidine gluconate cloth to clean the area at least 6 to 8 inches around the surgical site. Be sure to sleep in freshly laundered sheets. The morning of surgery, use the second cloth to clean the surgical area again, keeping the same 6 to 8 inch perimeter. Allow the area to air dry and do not rinse your skin. Dress in clean clothes to come to the hospital. On the morning of your surgery, remember to refrain from eating or drinking so that anesthesia could be safely administered. This includes avoiding gum, lozenges, and breath mints. Do not take your usual morning prescription medications unless specifically instructed to do so by the anesthesia team.
If you are scheduled to receive chemotherapy, you will meet with your care team each time you come in before going in for your treatment. Unlike radiation that tends to take place 5 days a week, chemotherapy is less frequent depending on your care plan.
Your well-being and safety are our #1 priority, so we'll review everything with you so that you understand your operation. You will also meet with a member of our anesthesia team, visit with your doctor, and meet with your operating room nurse, all of whom are available to answer any questions you have, so don't hesitate to ask. After we verify the details of your surgery, we will sign a consent form that allows us to treat you. You'll then receive an IV and your surgical site will be marked on your body. Once the operating room is ready, the anesthesia team will bring you to the operating room.
You will be transported to the post-anesthesia care unit to recover and wake up from your surgery. You will have a nurse beside you to carefully monitor your vital signs and well-being. He or she will remain with you until you are awake and alert and will administer medications to keep you comfortable. If you have a lap band procedure, you will go home the same day. All other surgical patients remain in the hospital for 24-hour observation to monitor for potential complications and assure there are no leaks in your digestive tract. Compression boots will also be applied to help prevent blood clots. We'll encourage you to walk several times during your stay because walking not only promotes circulation, but will also aid in dispelling the air in your belly.
Surgery, illness, or admission to the hospital can compromise the immune system, so providing an adequate diet promotes regaining and maintaining strength. Dietary needs can vary greatly from patient to patient, but there are general principles of nutrition that apply to every person. If your loved one is being discharged with a special medical diet, you will likely meet a dietitian for individualized care plans to meet those needs, but following guidelines of general dietary practices will put you on an excellent path to helping your loved one recover well.
Prescriptions are intended to be used only by the person it is prescribed to. It is extremely unsafe for anyone else to take another's medication, so don't let anyone else try another person's medication for a similar illness or disease. You might want to consider having a lockbox for certain medications, particularly narcotics. Narcotic abuse has become an epidemic in our country, so safeguard anything that could be potentially harmful or tempting to another person. Store medications in a cool, dry place, away from children's reach. Certain meds need to be refrigerated, so be sure to read the labels carefully and store them accordingly.